In 1999, the Kenyan government declared HIV and AIDS a national disaster. It then proceeded to establish the National AIDS Control Council in the same year, whose key mandate was policy development and coordination of resources with the hope of achieving an HIV-free society. 15 years later, the dream is yet to be realized. However, significant progress has been made in tackling the disease. The prevalence rate of HIV stands at 5.6%, while the rate of new infections is at 0.4%. A close evaluation of the country's battle against HIV and AIDS portrays lack of synergy among various agencies. Perhaps it is for this reason that Awendo MP Jared Opiyo is seeking to turn the tides and accelerate the progress by introducing the Kenya AIDS Authority Bill 2014 to give autonomy to the National AIDS Control Council.
This particular bill intends to bring a coordinated, a systematic and coordinated approach towards the fight against HIV and AIDS. The authority is able to utilize funds that it will be getting directly from the exchequer. The authority will be answerable to Parliament.
In the bill, he wants the National AIDS Control Council rebranded as a statutory independent entity through an act of Parliament. This has received support from stakeholders who argue it will enhance accountability.
This is where we have an opportunity as civil society actors to go and tell Parliament, the fight for HIV is scourge. You do not allocate enough finances. Can you allocate more? Because these are the needs and versus what you have been able to allocate. There's been some political influence in terms of how National AIDS Control Council is managed. Here we are going to have an independent authority that is able to run the country professionally without due interference from any quarters. So it gives it some bit of legitimacy, some bit of autonomy and authority to be able to take up HIV/AIDS issues.
Currently, the National AIDS Control Council receives funding through the Ministry of Health. A provision Opiyo argues is dependent on the goodwill of the government of the day to allocate funding.
Initially, the National AIDS Control Council was under the ambit of the Office of the President. The person who wants to account for this money is from the Ministry of Health. The patron of this committee is actually the Member of Parliament. There is no way, it was not very easy. For instance, if a coordinator decides to embezzle the fund or to give it to briefcase organizations, which then does not take the money to the people who need that intervention, it becomes very difficult for the Member of Parliament to punish a Ministry of Health official.
At the same time, the bill proposes National AIDS Authority be given powers to invest the unused funds as well as boost programs to realize the dream of getting to zero new infections and consequently achieving an HIV-free society. The proposed law also gives the authority powers to mobilize all stakeholders participating in HIV and AIDS programs as well as collaborate with the local and international agencies. The bill proposes the authority's board of directors should comprise of persons nominated by a selection panel and appointed by the president. Nominees of the selection panel shall consist of one person nominated by the president, the Health Cabinet Secretary, the Public Service Commission, the National Council of Persons with Disabilities, a joint forum of religious organizations, the most representative association representing persons living with HIV and AIDS as may be determined by the Cabinet Secretary, and the Association of Professional Societies in the East Africa. The nominees are then to be vetted by Parliament before appointment. Kenya AIDS NGOs Consortiums, however, argues the board should have representative from NGOs as well as Council of Governors to represent the NGOs and the counties respectively.
How many people are accessing ARVs drugs? How many people have been tested? How many people are able to access tuberculosis drugs? How many people, how many children have received vaccination? It was very easy because it was centralized and there were tools to do that. With the new system of governance, there's been a little bit of a challenge, especially by the county government, to be able to report accurately and timely the data that is coming from the ground. So there's been a challenge whereby if you're to look at our health outcomes in terms of how our health services are reaching different segments of the community, you find the data is a little bit lower.
Kevin Wachira for the Bill Tracker.